Hi, I'm Dr. Castanet. I'm going to explain to you today why people have neck and back pain. And I'm going to use a model to show you. This is a model of two vertebrae. Happens to be in the low back, but what I explain is true in the neck as well. And the anatomy is fairly similar in the neck. This part of the spine would be two vertebrae. This would be the front of your body where the abdomen is. This would be the back. These processes are little bones that you can actually feel if you run your finger down the midline of your spine. There are discs between these bones, there are nerve roots in the low back that run in this canal, this hole where the spinal cord ends at the upper part of the low back, and then nerve roots continue down the canal, and then they exit in pairs, one from each side, right and left, between the vertebrae. The discs over time, for a variety of reasons, wear out. The disc itself is made up of two basic components. The first is these tough, fibrous annular fibers, connective tissue, that enclose a more hydraulic or water content component that's a little bit like crab meat in its consistency. These fibers in the middle that imbibe water or absorb water, then under compressive loads from being upright, they then push out against the peripheral fibers that enclose the inner part and distribute the load to the periphery of the fibers. Over time, from little micro traumas and macro traumas, and probably as a result of a net negative regeneration day to day from the physical demands, and also from your nutritional or substrate status, the regeneration that occurs during the night when you rest may not keep pace with the degenerative influences on the disc, and over time you can acquire little tears of the inner part of the disc. The inner part of the disc does not have a nerve supply, so these little tears that start in the center are not appreciable. You don't feel pain, and you don't necessarily correlate your physical activities and the insults that you're imparting to your spine and your disc specifically to those to the injuries. And as a result, when you're younger, you don't learn what physical demands and injuries are causing injuries to the disc. But as you get older and these tears migrate further to the periphery of the disc fibers, they then become appreciable as pain because the outer fibers of the disc are innervated. Then you begin to feel pain. The pain usually starts in the low back, and as the process progresses, there can be bulges of the disc because the inner content, as the outer peripheral fibers weaken, can then push out further and further through the weakened fibers, and then they can approach the nerve roots, which are right behind the disc in this canal. And if they hit a nerve root, you will get inflammation of that nerve root, such as depicted by this red herniated disc pinching the nerve root. When that happens, you will feel pain in the distribution of that nerve root. The nerve roots in the low back give rise to the sciatic nerve. You've probably heard of the term sciatica, which means pain in the distribution of the sciatic nerve. So any of these nerve roots, L4 through S3, that make up the sciatic nerve and contribute to the sciatic nerve, if any of these contributing nerve roots is pressured by a disc bulge or herniation, then you'll feel pain where that nerve root goes, and if it makes up part of the sciatic nerve, you will feel pain that can radiate down into your buttock, the thigh, the leg, and all the way to the foot. Generally, the further down the leg the pain goes, the more compression on the nerve root. As your pain migrates from the low back to the buttock, to the thigh, to the legs, we call that phenomenon of progression distally peripheralization of the pain or sciatica. And generally, if you treat this effectively and it improves, the symptoms will reverse, so that if the pain goes all the way to the foot, your symptoms in the foot will dissipate first, and then the leg, and then the thigh, and then the buttock, and lastly the low back. So that's the nature of why we have neck and back pain. As the spine ages, as a consequence of this injury to the disc, which is fundamentally the first part of the aging of the spine, then that disc will lose water content in it, and it will begin to collapse progressively. There will be less and less space between the vertebrae. I'll give you an example of that. This pair of vertebrae with a thicker disc and a higher space or higher disc between these vertebrae is supposed to be a normal disc. On end, this is supposed to be a disc with the inner part I described. It's called the nucleus pulposus, but that's not important. What's important is that it has this crab meat consistency, that it's like a sponge, in that when you're non-weight bearing, it imbibes water during the night. This is also why in the morning you're taller than you are at the end of the day when you've been weight bearing all day. Then as you're upright, this spongy tissue or crab meat tissue that has imbibed water will slowly dissipate the water over the course of the day under physical demands, so that you're shorter at the end of the day. Then you lay down, you're recumbent, and the process starts all over again. Non-weight bearing, that tissue in the center will imbibe water again, become rehydrated, and you'll start the next day with a bigger disc. This, we're talking about millimeters, so this is not something that is all that appreciable, although, like I said, you're taller in the morning because a few millimeters at several disc levels can make a difference in height that is appreciable and measurable morning to evening. So let's get back then to this progressive, what I call the normal progressive degenerative compression of the spine. So as you lose disc height, there is more pressure on the bones as they approximate. They respond by developing spurs or arthritic changes or degenerative changes. That happens both in this part of the vertebra, which we call the body of the vertebra, and it happens in this, in the rest of it. This arch here, which we call the neural arch, and a part of the neural arch that degenerates is the joints on each side. In this case, this person is facing me, their back is to you. This is their right joint, this is their left joint. When the vertebrae approximate, because the disc collapses, there's more pressure on the joints, they enlarge. As they enlarge in all directions. That includes into the region of the canal, and so you can get a canal that's smaller. So you have discs that may bulge, you have bones that may grow in several directions. All of those changes make this hole smaller, this neural canal. This canal can become narrow. We call that stenosis, just means narrowing. If you look at MRI reports, the term stenosis can be used a couple of different ways. Because it means narrowing, it can simply mean narrowing of this hole from the degenerative changes. It can also mean narrowing the holes in the side, because as the vertebrae collapse and the disc collapses, this hole on the side, which is made up of the space between the two vertebrae, becomes smaller. Discs can also bulge or herniate into that space, also making the space for the nerve roots smaller. There's another way in which we use the term stenosis, not just simply as a simple description of the anatomy here of the spine, but we also use it to describe a clinical picture. In other words, a description of the way the patient presents. Since it means narrowing, and because narrowing of this canal can become very severe over time, when it becomes very severe over time, the patient will end up bent over. You see these people in public. They lean over grocery carts, classically. It can become so small that it pinches all the nerves that are running down the canal. When that happens, they can have pain down both buttocks and both thighs in the back. And the only way they can get relief is to bend over, such as leaning over a cart, or they can sit down, which also opens up the area and makes a little more space. Sometimes this gets so bad that people can walk for only a couple of minutes at a time, 2 or 3 minutes, then they have to sit down, take some rest, then they can stand back upright, walk for another 2 or 3 minutes, and so on. So we can use stenosis as a term to describe the anatomical changes in the spine, or we can use it to describe this clinical picture or description of a patient who has these changes to a very significant degree and assumes these behaviors of bending over a cart and walking bent over and is limited in their walking. Anyway, that's the nature of the spine, why it gives rise to pain. You could characterize all of these things as compressive in nature, meaning that the disc is compressed, the bones are compressed, the joints are compressed, the nerves can become compressed, and all of these can give rise to the pain generators in the spine, which are typically the disc itself, when the outer peripheral fibers of the disc become involved, the joint, when the joint becomes degenerated and enlarged and arthritic and there's more pressure on it, and the nerve root, if the nerve root becomes pinched, either acutely or chronically in the case of stenosis. So the way to characterize all of these things is a compressive process, and it's a slow, progressive, degenerative on its basis compression of the spine, all giving rise to pain from the 3 pain generators: discs, nerves, joints. How best to treat this? Well, we do a lot of things like exercises in physical therapy or chiropractic and adjustments and things like that. But those don't really effectively address the process of compression. So the most effective way to treat this, in my experience, and I've treated over 40,000 people in 35 years now, using all sorts of chiropractic and physical therapy measures, and I spent 18 years in orthopedics and physical medicine and physical therapy, and I spent 5 years in neurosurgery. So this has been a really interesting topic of mine for that long, since '83 when I started school. But the best way to treat this, in my clinical experience, is to use some treatment measure that will decompress this problem. Decompressing this problem, this process, is the most direct and therefore, in my experience, the most effective way by far, by a very large measure, to treat this compressive process. How do we do that? Well, I will show you in other videos, but I put people on a table that decompresses this problem. When you decompress these problems, all of these, at several levels in the low back or several levels in the neck, you address the nature of the process that gives rise to pain, and as a result, it's the most effective way to treat people with neck and back pain by a large measure. Over the course of my 35-year career, I've used all sorts of treatment modalities in orthopedics and physical therapy and physical medicine and chiropractic, and many of them have some merit. but nothing has worked as effectively as decompressing this compressive problem. So I put patients on a table, I grasp their anatomy. Depending on whether it's the neck or back, you grasp different parts. In the low back, you would grab the pelvic structure and also underneath the ribs. If you grab these two components, the ribs here and the pelvis here, what lies between are 5 lumbar vertebrae. If you decompress these structures by gently distracting and pulling apart the rib region and that thoracolumbar region where the ribs attach to the pelvic region, which is attached to the sacrum and the low back vertebrae, these intervening 5 low back vertebrae or bones can then all be decompressed. It's a comfortable, slow process. If you do typically the first treatment, 80% of people will get relief. Sometimes a little, sometimes a lot, but 80%. And that's extraordinary in the treatment of back or neck pain. Most of the treatments, all of the treatments, in my experience, are not going to have that kind of success rate that quickly. Furthermore, if you do as many treatments as is necessary, which varies from person to person and problem to problem, to get the person better, they will, in my experience, get better faster, get more profoundly better. It will last longer. And the reason I say that is because these are degenerative processes, so you don't treat this person, give them their 15-year-old spine again, and expect that they'll go for another 40 years without problems or pain. They're already at some point in the process of degeneration, so typically when you treat them and you decompress it enough, you'll get them out or much better in terms of their pain. It will last a long time, typically many months to several years before they have another problem or the same problem again. And it is by far the least expensive, the fastest, the most effective way to treat back problems. So I do other videos explaining other pathologies in the back specifically, but most back pathologies, with the exception of instabilities, and of course the very rare malignant processes like cancer, infections, fractures, dislocations. Apart from those, what I've just described is the common reason people have back pain more than 98-99% of the time, and I've described the most effective approach to treating these problems. I'm Dr. Castanet in Decatur, Georgia. If I can help you, call me 404-558-4015, and thank you very much. Bye-bye.